The United Nations have set aside the first day in December to celebrate the World AIDS Day to raise awareness and encourage prevention. The African continent remains vulnerable as it records about 68% of the epidemic, giving a cause to call for equal access to healthcare, improve awareness and reduce stigmatization. News Centre's Adeshewa Odushoga has details.
Ayomide Akinola is a 22-year-old who has lived with HIV as a result of a mother-to-child transmission. She has learned to live with the virus in the last 16 years and has now become an advocate, creating awareness about the epidemic.
Instead of blaming someone or trying to put a blame on who and how I got infected, because it was through mother to child. Yeah, my dad was positive, and he hid it from my mom.
There are 34 million people living with HIV in the world. Out of this number, 23.8 million of them live in Africa. Although the continent has improved in its access to healthcare, recording success in the prevention to mother-to-child transmission, the lack of adequate awareness, stigma, and sexual violence against women still put the people at major risk.
Nigeria's ability to reach and sustain HIV epidemic control will be compromised if we remain silent to the real issues faced not only by key populations, but also by adolescent girls, young people, and communities that are isolated from quality healthcare services due to geography or to insecurity. This year, PEPFAR identified and initiated 6,309 HIV-positive pregnant women on ART.
As Lagos State, we're fighting to reduce stigma and discrimination because this is one of the reasons why they isolate themselves from all the services that we render. So we're working tirelessly to continue to train, retrain our health workers.
Based on antiviral therapy alone, we can actually harness and end to HIV epidemics by year 2030. Because what we have at our hands today are molecules that will not allow the virus to continue to replicate, will not allow the new uninfected cells to become infected.
The United Nations had set a 2030 deadline to end AIDS in the world. With just years left, the World Health Organization raises fears that the virus is not decreasing fast enough as millions of people remain undiagnosed and untreated.
Mpox shows that infections can move quickly in sexual networks, but with community-led response and open attitudes to address stigma, transmission can be prevented and lives can be saved.
Reports have shown that young women in Africa have remained disproportionately affected by HIV, while coverage of dedicated programs for them remains too low. As the world celebrates the World AIDS Day, there is a call to address inequalities in vulnerable regions like Africa, as it holds back the progress to combat the epidemic. Adeshewa Odushoga reporting for News Central.
Many thanks, Adeshewa. We're now joined by Dr. Tope Ayomide Akinola, consultant gynaecologist with Evercare Hospital, Lekki Lagos. Thank you very much for giving us your time. Let's start with the awareness rate. It seems to have dropped in Africa. What do you think the reason is, and can we improve it?
Yes, concerning the awareness of HIV in Africa, there are several hydra-headed problems responsible for the drop in awareness. These include a drop in resources, and also things like COVID-19 pandemic has taken our attention away from HIV/AIDS, making a lot of people to forget that it still remains a problem with us. It remains a major public health problem, and women remain a major part of the vulnerable population. So a drop in resources responsible, and the COVID-19 pandemic responsible. And I must also say there are so many sociocultural barriers also that have impeded the awareness that HIV/AIDS used to have many years before the pandemic.
In 2021, we understand 1.5 million people became newly infected with HIV, bringing the total number of persons living with the virus to 38.4 million. This is by all standards very alarming. What should be done that hasn't been really properly explored in trying to curb the spread?
Yeah, so that serves the main reason for the theme of this year's World AIDS Day, which is about sort of equalizing. Equalizing means we need to identify the problems associated with disparity and access. Okay, there's a lot of problem disparity, and people don't have enough access in terms of access, availability of proven methods to prevent and reduce the burden of HIV/AIDS. So it's not just about ensuring that antiretrovirals are available in government centers for people. We should identify those things that constitute barriers. And I give an example. Gender, part of the inequality we are talking about is gender, the gender inequality. You have the vulnerable, women being the vulnerable people, and a lot still not being done to address the problem of access, availability, and acceptability of proven methods for them. And to give a practical example, do you know that in a study identified in 2021 found out that just educating the girl child alone up to secondary school education led to a 50% reduction in vulnerability to HIV/AIDS. So you find out that the problem has been much of just, you prevent, making sure that trials are available. But what are those socio-economic problems? What are those political problems? What are those cultural problems that are affecting access to ARVs? What are those attitudes? What are those harmful traditional practices? What are those issues, things like intimate partner violence, that is increasing the vulnerability of the population at risk? So you find out that it's not just about the idea of trying to reduce the global burden of HIV by year 2030 will still remain a mirage if we do not address the problem of equality, ensuring that there is a balance in terms of access, availability across all group of people, including the vulnerable people at risk of HIV/AIDS.
Let's talk about stigmatization for a moment. That is still a major challenge. What's your assessment of the effort in Africa to deal with this along with other issues?
Now, there have been legacies in Africa. I must say that a lot of global partners, the World Health Organization, the Joint United Nations Agency on AIDS, and a lot of bodies have come up with a lot of policies. In fact, legislation to address the problem of discrimination and people being judgmental in terms of HIV/AIDS. So now we need to really develop a lot of people's orientation, both at the community level and not just leaving this to the big non-governmental organizations to handle. How do we address the issue of people having access? Even those who are living with HIV/AIDS, how are we addressing the issue of interacting with them, not being judgmental in terms of access to job employment opportunities, and people, not the society, understanding fully well that there are certain ways it cannot be transmitted. So you find out that even you see a lot of learned people who still discriminate and say, because somebody is HIV positive, you can't shake the person's hands, even among very learned people. So a lot of awareness still needs to be done to reduce this stigmatization. This will allow a lot of people to come for testing. And those who have done a lot of testing will, if found out that their status is positive, they will know that it's not necessarily a death sentence.
Indeed.
Because being HIV positive does not mean the patient has acquired the AIDS or the acquired immune deficiency syndrome,
yes,
which are
indeed.
two different things entirely. So a lot of effort will be done in Africa in terms of legislation and policy, if possible, to make sure that there are strict penalties for people who discriminate against these people, discriminate against people who are living with HIV.
The will will always be the problem when it comes to implementation, isn't it? Well, we'll have to continue this conversation another time. Thank you very much, Dr. Akinola, for speaking with us on the news.
It's a pleasure to be with you.